All right, so infection prevention and control. This is from chapter 23 in your fundamentals textbook, and then also pulled from some of your ATI infection control. So, why is it important that we talk about infection control? We talk about infection control to help protect our patients. We want to also help protect ourselves because we don't want to help take care of these really sick patients and end up getting sick ourselves or taking something home to our families. We also talk about this, and it is important to help meet standard precaution guidelines, which we're going to talk about, and help lower the cost of healthcare. So, some of our learning objectives, we're going to look at the links in the chain of infection. We're going to look at the different stages of a typical infectious process. We're going to look at 4 processes involved in primary, secondary, and tertiary defense. Discuss factors that place an individual at increased risk of infection. Look at standard precautions to help prevent transmission of infection through blood and bodily fluids. Then we're also going to talk about the additional precautions like contact droplet airborne, and then talk about just some infection prevention control measures in the home and in the community. So when we look at the chain of infection, chain of infection is like a chain link fence in a way. It's all linked together, and all of these links have to happen for an infection to occur. I know you all don't have your ATI books yet, but hopefully you will soon. But I encourage you to reference chapter 11 on page 54 that just talks about the chain of infection. So, like I said, all of them have to be present in order for an infection to be transmitted from one person to another. So, for example, your infectious agent, that's going to be the germs or the pathogen. You have to have that in place for it to get spread anywhere. So you have the germs, then you have the reservoir. So your reservoir where the germs live. So could be on your hands, could be on elevator buttons, could be on door handles, anywhere where the germs like to hang out. So when we think about hospitals and where we're going to be doing clinicals at in different places, handrails on the sides of the bed, sheets, bedside tables. There's all kinds of places that the germs like to hang out. Then we have the portal of exit. So your portal of exit is the way that a germ leaves the reservoir. So through fluids, blood, any of your bodily fluids, it gets into that portal of exit and then gets transmitted. So then you have your mode of transmission. That's going to be how it's transmitted from one person or from one place to another. So transmission could be by touch, could be by sneezing, could be by ingesting or inhaling. There's going to be some sort of vehicle transmitting this germ. Then you have to have a portal of entry, and that's going to be how it gets in, how it's going to get into the body. So in the healthcare setting, we typically have things that are inside the body that shouldn't be there that we put there, such as an IV or a catheter. So those are great sources of entry for these germs, this infectious agent to enter in. Then you have your susceptible host. So that could be anyone, could be any of us. Particularly you being in nursing school and newly being exposed to a lot of different things, you may be a susceptible host, but that could be anybody. So we want to do everything possible to try to break these links in the chain. So we try to come up with different ways that we can try to break these links. Hand washing is going to be super, super important. It's the number one way that we can help prevent infection. It's just washing your hands. So, like we mentioned a little while ago, we learn about these so that we can protect ourselves, protect our patients. So, ways in which we can help to break the chain. This diagram shows a really good picture in all the different links. It shows different ways that we can try to break each specific link. So, for example, hand hygiene. If we're trying to break the portal of exit, we're going to do hand hygiene. We're going to use our personal protective equipment. We're going to dispose of our waste properly. Hand hygiene, as you see, is almost on all of these because it is super, super important. Again, I encourage you to watch that video. If anything, it really makes you a little bit more aware of how things can get spread and how easily that they can get spread without us even realizing it. So, different modes of transmission on how these germs can be transmitted. We have direct, indirect, droplet, airborne, bloodborne, and vector. So, our direct transmission can be through a bite. For example, rabies gets spread through an animal bite. Could be through a handshake. Could be through sexual contact. Any way where someone is directly touched, it's being directly touched. Whatever illness, disease is being spread from one person to the other by direct touch. For example, for that, we would utilize contact precautions. We're going to go in a little bit more detail about these here in just a minute. But contact precautions, we're trying to prevent something from being spread by direct contact. So everyone would, wash their hands. They would use hand sanitizer, and at minimum, use a gown and a glove. You'd want to clean and disinfect shared equipment, dispose of disposable equipment appropriately. Indirect transmission. So this one is transfer of an infectious agent from a reservoir to a host by suspended air particles or inanimate objects or the vehicles or vectors. So a vector is going to be a living organism that carries an infectious agent on its body. Or as an infectious host itself to a new host. For example, you want to think mosquito, flea, tick. They're carrying around that illness or disease. A vehicle, you want to think about a fomite. So a fomite is going to be something like a stethoscope. So if I have my stethoscope on and I am going from patient's room to room, I can indirectly spread an infection with my stethoscope because it's acting like a vehicle. And if I touch one patient and I don't clean it in between patients, then I'm touching this patient, going to the next patient, touching that patient, and it acts as a fomite. So droplet transmission, we will talk about a little bit more in depth, like contact. You have a 3 feet danger area, and pathogens travel in water droplets, like as you see the sneeze there. They should have a private room or with others who also have the same illness. And you would want to wear a mask if you enter that room. Airborne, this one travels on air currents or dust particles. With your airborne, aerosols can travel long distance or times, so it's important to be in a private room with negative pressure, and you wear a special type of mask for this one. Bloodborne transmission, so if we have an illness or disease that is transmitted by blood, you may see a picture like this and think, you've got blood everywhere. So your main concern should be making sure that you're wearing the PPE that is needed and making sure that you're using all precaution possible so that we don't spread that to someone else. Some examples of these: hepatitis B, hepatitis C, HIV, syphilis, malaria. Any of those can be spread by bloodborne. So you just want to be extra cautious, especially in the healthcare setting, because if you don't learn how to use needles appropriately, needle sticks are a big concern. And so if you accidentally get stuck by a needle, you could be exposed to hepatitis B or hepatitis C or even HIV. So it's important to really follow those infection control practices. So again, your vectors, mosquitoes, ticks, fleas, could be a wild animal, could be livestock, anything that's going to carry a disease that could affect another human, could affect another pet. Some different types of infections that you can occur. Whenever we talk about different types of infections, you can have a localized infection. So that could be an infection that is, you want to think local. It lives in a small area around that spot. So like a upper respiratory infection, it lives just in that respiratory system, or a joint, just one specific joint. If it's systemic, then that is throughout the whole body. It could be it could reach the blood or lymphatic fluid, and it's being carried throughout the entire body. So some different types of infections. You have a primary infection, which is the first infection that a patient gets. And then you can have a secondary infection, which would be an infection following a primary infection that could happen because of the primary infection. So whenever we have an infection and you develop an infection, this is going to be the stages of how your symptoms are going to occur, or the stages of your overall infection. I promise this is going to be on multiple tests. You're going to see this again and again and again. So it's very, very important to make this make sense in your brain and remember which stage each of these are, because you're going to see them a lot. So stages of clinical infections. First stage, you're going to have the incubation period. So that one's going to be the time from your initial contact to you show us as a sign of infection. So this is like when you've been exposed to somebody who has the flu, but it's just hanging out in your body, incubating, ready to make you sick. You don't know you have it yet. You've been exposed, but you're not sick yet. The prodromal period, that is where you really show the initial symptoms and begin to get sick. Your invasion period, or your illness period, you have high levels of infection. It's reached its target tissue. You have the greatest toxicity of infection throughout your body during that stage. So if you look at the graph over here, it's at the very heightened point. And then your convalescent period, you're starting to recover, you're starting to get better and starting to return back to your normal. So for some reason, my slide is a little overlapped on this one. So I'll let you all read this one, but it does pertain to the different stages of your clinical infections. Hopefully yours is not overlapped on your screen. So we all have some natural defenses in our body that can help fight off some infection. One being our skin. Our skin's going to be our largest organ. That's going to help fight off infection. It helps protect everything inside. So you really want to keep intact skin, not have any openings, because that just creates an opening for infection to come in and create a place in your body. So defense from the inside and out, different places that we have defense mechanisms throughout our body. So overall, you have normal flora throughout your body. Your respiratory tree, it helps to expel, filter, and you have mucus that helps to provide some defense against infection. Your eyes, you have glands that help defend against infection. Your mouth, you have saliva and blood supply. GI tract, you have it's acidic, you have bile, you have peristalsis that helps move everything through, and you have flora in there that help prevent against infection. That's kind of why whenever you start to take some antibiotics, you want to eat some yogurt, because when you take antibiotics, you wipe out all of the good and the bad flora throughout your GI tract. So if you eat yogurt, it actually has probiotics to help introduce some of that back in. Your GU, you have mucus, it's acidic, and you have lysozyme to help prevent against infection. Lysozyme is a antibacterial enzyme that just helps provide that defense mechanism. So different types of immunity. This is important to kind of differentiate in your mind as well. Active immunity. So if you are immune against something and you have active immunity, natural active immunity is, for example, let's say COVID. You have had COVID, so you have natural immunity because you have had the infection yourself. So your body has built up these antibodies to help try to fight off that infection. Artificial active immunity would be like if you had the COVID vaccine. Passive immunity, it's being passed on. So a natural way, maternal antibodies. So mom breastfeeding baby, that passes on that natural passive immunity. So one way to keep track of these is your active, your body makes. But your passive, you're getting it from somewhere else. So mom giving antibodies to baby, she's passing them on. The baby's getting the antibodies from somewhere else. Artificial, you can also get monoclonal antibodies. And so the antibodies are given, they're being passed on from somewhere else. So immunity or infection, these are just some blood tests that can be drawn that can tell whether you have immunity to something or you have an actual infection going on. Not real important right now for you to know, just kind of be aware that they're out there. So what are some things that increase your risk for infection? So some things that are going to increase your risk for infection, a weakened defense. So you have some sort of weakened defense that we just talked about in or outside of your body. Something is weakened that is able to let infection in. A break in your first line defense. Maybe you have an open wound that can let infection in. You could have a catheter or an IV line. You have a break in your natural defense that can let in infection. Substance use. So any type of substance use, alcoholism, drug addiction, any of those weaken your immunity, and so you have an increased risk for infection. Tobacco use. So those nice little hairs in your nose, it's important to have those to try to help keep out infection. It's a great way that your body works to help as a defense mechanism. But tobacco use kind of paralyzes the cilia and causes secretions to pool. Multiple sex partners, you have a higher risk of transmission in an environment. If you work as a teacher, in a nursing home, a parent around sick kids, that's going to increase your risk for infection as well. Chronic diseases, certain medications, like cancer patients that are on chemotherapy, they're going to have increased risk of infection. And then nursing or medical procedures, like we talked about, IV sites, catheters, any kind of invasive device. So, physical assessment. This is going to be important because you don't know what is wrong unless you assess it. You all are going to learn how to assess every body system. So, if we're suspecting that someone is sick, we can look at their overall appearance. Are they acting normal? Do they appear fatigued? Do they look ill? We can look at their skin. Does it look like they have an infection? Is there pain, redness, swelling? Do they have a rash? Do they have a break in their skin? Lymph nodes, we can look at if their lymph nodes are swollen. And then vital signs, we can look at, is their temperature elevated? Is their pulse elevated? And just kind of see, are there changes that we are seeing in their vital signs that could indicate they may have an infection. So teaching infection prevention, we want to make sure that we are teaching our patients to eat good meals, that we're teaching them about good nutrition and eating all the food groups. We're teaching them good hygiene, to shower, wash their hands frequently. We're teaching them to get adequate rest, adequate exercise and activity. We can teach them stress reducing techniques and teaching them to get their immunizations on time as well. A lot of times as nurses, we often cause or allow infections based on some things that we do. There are actually people in the hospitals who their job is to watch whether you wash your hands or not. They do audits to see how well you do at washing your hands. Certain facilities have badges that have to be scanned, like as they go in the patient's room, they will scan the badge to show that they are washing their hands as they're going in, washing their hands as they're coming out. So some things that we can do to try to help prevent infection as nurses. We may use sterile gloves for sterile procedures. So if it is a invasive procedure or a procedure that requires sterile procedure, we'll make sure to keep our sterile field. We'll put on our sterile gloves appropriately so that there are no potential for contamination. We can use non-sterile gloves or procedure gloves for contact with potentially infectious material. Hand washing. We want to use adequate hand washing. If your hands are visibly soiled, you need to wash your hands. Sing the birthday song. Sing one of your favorite songs 2 times if you need to, or just, the chorus of it 2 times to make sure that you're washing your hands appropriately. You should be washing your hands for at least 20 seconds. And then foam in, foam out just talks about using your hand sanitizer as you go in and using it as you're coming out. So these are just some infectious disease precaution guidelines. PPE is our personal protective equipment that we use. If we are talking about standard precautions, it's something we're going to do all the time. So we're treating all patients as if they are infected. We are washing our hands all of the time with every patient when we, before we touch them, after we touch them, after they're visibly soiled. We're using what PPE we need in order to make sure that we're not transmitting any disease to anyone else. Airborne, we want to make sure and remember we're going to wash our hands. We're going to use an N95 mask, keep the door closed. Droplet, we're going to make sure and wash our hands. You may need a shield to cover your eyes and mouth, and you're going to stay within a 3 feet distance. Contact, at minimum, you're going to wash your hands, use gloves, use a gown. So just an overview, like we mentioned, standard precautions, patient page 56 in your ATI book is a really good resource, but you want to make sure you're washing your hands or using the hand sanitizer. There are certain diseases or illnesses that you are not allowed to use hand sanitizer because it does not kill the spores. For example, C. diff or Clostridium difficile, you have to physically wash your hands. A lot of times we'll put a sign over the hand sanitizer so that you know you have to wash your hands. So transmission-based precautions, and so standard we're going to use for everybody. Transmission-based is what we're going to use based on certain illnesses that they may have and what we're going to use for each specific one. So contact precaution, this is direct or indirect contact you're going to use to protect caregivers and visitors when they're within 3 feet. So there's some examples of some illnesses that we're going to use that for. And like we said, gown and gloves when you're entering the room. You're going to take this off in the patient's room right before you come out of the room so that it doesn't go into the hallway. Droplet precautions, you would make sure that you have a surgical mask whenever you're entering the room. A patient would be in a private room if possible. If your patient is leaving the room, you would want to make sure that you put a mask on them before leaving the room. You'd want to make sure that they are coughing or sneezing into tissues or their sleeve. This would be your patients who may have the flu, the influenza, adenovirus, or the rhinovirus, which is your common cold. And then the nurse would make sure to wear the surgical mask to help prevent the droplets from entering the respiratory tract. Airborne precautions, this one is like the next step up. So any of these, droplet or airborne or anyone in general, if you ever think that you're going to have splash into your face, you're also going to want to add eye protection or maybe a face shield. Specifically with droplet or airborne, you want to think there's droplets being involved. You want to protect your eyes. So airborne precautions, we're going to have a private room and the door must be closed. They will have a specialized negative pressure room. The nurse must have an N95 respirator mask prior to entering the room, must be appropriately fitted. So this is something you will actually go through a fit test to make sure that you have the appropriate fitting mask. Some of these illnesses are going to include your droplet infections that are transmitted that are smaller than 5 micrograms. So measles, varicella, pulmonary or laryngeal TB. It's traveled in the dust particles throughout the air. So it's very, very small. And N95 is made so that it can keep out those particles. The last one is going to be your protective isolation. So this one is a little bit different. This one is more so to protect the patient. So protective isolation are typically for your immunocompromised patients. Could be stem cell patients that have had a transplant, could be cancer patients, anybody whose immune system is low and to a certain point, the doctor may want them put into protective isolation. Typically with this one, plants are prohibited. Fresh fruit, vegetables are typically not permitted either because the possibility that they could be exposed to something that could make them sick. The nurses that are caring for these patients, they should be healthy and without any illness. And these patients should be in a protective environment in a special room engineered to prevent environmental transmission of organisms. So, for example, protective precautions, you would want to be in a positive pressure room. Airborne, you would want to be in a negative pressure room. So think patient is dirty inside, okay, and it's clean outside. The dirty is going to be filtered out of the room so that it's not being circulated back into the patients, throughout the hospital, and it goes through a specialized filter. Positive pressure